The MD has ordered IV gentamicin for a patient diagnosed with peritonitis. Which action is most important before administering this medication? Answer choice A, assess coagulation report. B, check serum creatinine level. C, check for hyperkalemia. D, assess blood pressure. Hello everyone, it's Nurse Mo from Rophem NCLEX Academy. Let's answer some NCLEX practice questions on aminoglycoside antibiotics. So this is our question 1. Which of the answer choices will you select? The correct answer is B, check serum creatinine level. This is the reason why. Gentamicin is an aminoglycoside antibiotic. Aminoglycosides are nephrotoxic. They can cause acute tubular necrosis and damage to the kidneys, which can lead to renal dysfunction. It is very important to check kidney function before administering this medication. Serum creatinine level will let the nurse know how the kidneys are doing. That way, the nurse can make a safe decision whether to give or to hold the medication. Potassium level is not directly affected by aminoglycosides. The same goes for coagulation report. Gentamicin is not a blood pressure medication, so answer choices A, C, and D are not correct. Question 2. A client is on prolonged aminoglycoside therapy. Which adverse effect should the nurse be mostly concerned about? Answer choice A, chronic bronchitis. B, dizziness and vertigo. C, constipation. D, hypoglycemia. Which of them is your choice? Correct answer is B, dizziness and vertigo. Let's break it down. Aminoglycosides can cause irreversible ototoxicity, which affects hearing and balance. Dizziness and vertigo indicate ototoxicity, which is a serious adverse effect of aminoglycosides. This adverse effect may be permanent, and because of this, they are usually prescribed for severe infections, and careful monitoring is required. Prolonged use of aminoglycosides doesn't lead to chronic bronchitis, constipation, or hypoglycemia. This is question 3. A client with sepsis is receiving IV gentamicin. The nurse should monitor which laboratory value to assess for nephrotoxicity. Answer choice A, AST. B, ALT. C, BUN and creatinine. D, potassium. What do you think about this one? Correct answer is C, BUN and creatinine. This is the rationale. Elevated BUN and creatinine indicate impaired kidney function, which is accurate to assess for nephrotoxicity. Answer choices A and B are not correct because AST and ALT are blood tests to assess liver functions. Answer choice D is not correct also because potassium is an electrolyte and it is not used to assess nephrotoxicity in patients taking aminoglycosides. This is question 4. A client with sepsis who is receiving gentamicin reports ringing in the ears. What is the priority nursing action? Answer choice A, document the finding. B, reassure the client. C, hold the medication and notify the provider. D, administer the next dose early. Which of them will you select? The correct answer is C, hold the medication and notify the provider. This is the reason why. Ringing in the ears is tinnitus, which is an early sign of ototoxicity, and it requires immediate intervention. The nurse should not administer the next dose. Patient report is abnormal and the nurse should promote patient safety by holding the medication and contacting the doctor. Answer choice D is not correct. The nurse should not administer the next dose early. Patient is already having an adverse effect from the medication. Answer choices A and B are also not correct. This is question 5. The nurse is caring for these 4 patients. Which client is at highest risk for aminoglycoside toxicity? Answer choice A, a 25-year-old patient with pneumonia. B, a 40-year-old client with UTI. C, a 70-year-old patient with chronic kidney disease. D, a postpartum client. What do you think about this one? Correct answer is C, a 70-year-old patient with chronic kidney disease. This is the reason why. The patient in answer choice C is an older adult. Patients who are at highest risk for aminoglycoside toxicity include older adults and those with renal impairment. The older adults have age-related changes in renal function. And for people with renal impairment, the kidneys are already not working well and medication clearance is reduced. Look at the patients in the other answer choices. They are not at high risk for aminoglycoside toxicity. This is question 6. The nurse is planning to administer the next dose of gentamicin as ordered. When should the nurse draw a trough level for gentamicin? Answer choice A, 30 minutes after infusion. B, immediately after infusion. C, 1 hour after the dose. D, right before the next dose. And your answer choice is which one of them? The correct answer is D, right before the next dose, because a trough level is the lowest concentration of this medication in the patient's blood. Trough levels are drawn just before the next dose, and this is set up like this to make sure the dose is effective and toxicity is avoided. The other 3 answer choices indicate after administration of the medication, so they are not correct. Let's take a look at question 7. Which instructions should the nurse give to a client who is taking oral neomycin? Answer choice A, take with antacids. B, report hearing changes immediately. C, increase potassium intake. D, expect urine discoloration. Which one will you select? Correct answer is B, report hearing changes immediately. This is the reason why. Aminoglycosides can cause ototoxicity. Clients must report hearing loss or dizziness immediately. Neomycin doesn't change the color of urine. An example of a medication that changes the color of urine is urinary analgesic pyridium. So, answer choice D, telling the client to expect urine discoloration is not correct. Antibiotics should not be taken with antacids because they reduce the effectiveness and the antibiotics may not work the way it's supposed to. This is question 8. Which of the following medications should not be administered with aminoglycoside antibiotics? Answer choice A, Tylenol. B, furosemide. C, metoprolol. D, vitamin C. How about this one? Which of them will you select? Correct answer is B, furosemide. Here is the reason why. Aminoglycoside antibiotics can cause ototoxicity. Loop diuretics like Lasix, if given together, can lead to a serious medication interaction which will greatly increase the risk of ototoxicity. So, aminoglycoside antibiotics should not be given with furosemide. In answer choice D, vitamin C can be protective during an infection by working to support the immune system. Tylenol and metoprolol do not have specific interactions with aminoglycosides. Let's take a look at question 9. Which statement by the client indicates correct understanding of the instructions regarding aminoglycoside antibiotics? Answer choice A, I will stop the drug if I feel better. B, I will report decreased urine output. C, I can take this with any medication. D, hearing loss is temporary. And your answer choice is which one of them? Correct answer is B, I will report decreased urine output. Here is the reason why. Decreased urine output should be reported because it signals nephrotoxicity. The other answer choices do not show correct understanding of the instructions. Patients should not stop taking antibiotics because they feel better. Answer choice C is not correct because there are some medications that should not be taken with antibiotics. For example, antacids. Antacids should not be taken within 1 to 2 hours of other medications. If taken with antibiotics, the antibiotics may not work as it's supposed to. Answer choice D is also not correct because hearing loss that is caused by aminoglycosides may be permanent. This is question 10. Which assessment finding in a patient taking gentamicin requires immediate follow-up? Answer choice A, mild nausea. B, tinnitus. C, dry mouth. D, fatigue. What do you think about this one? Correct answer is B, tinnitus. Let's break it down. Aminoglycoside antibiotics are very strong. They are effective against severe bacterial infections, but they have adverse effects that may be permanent if care is not taken. Ototoxicity is one of them, and it can lead to tinnitus, vertigo, and irreversible hearing loss. The other answer choices are not correct. Thanks for watching and learning from this video. If you want a more NGN focused NCLEX prep, our NCLEX prep courses will improve your critical thinking, application, and clinical judgment skills. If you are a repeat test taker, I have a course that is built specifically for you. And if you need remedial course, we are approved by the Florida Board of Nursing. Don't forget to like and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.